Community health care providers who are federally qualified are facing a crisis. They're seeing more people with little money or having no health insurance who need health care.
There are also fewer federal dollars. New tonight, John Chapman tells us how they're hoping to get the attention of lawmakers.
One World Community Health Centers provide a long list of clinical services, including medical, dental, and prenatal care.
We are unfortunately not able to accommodate all the requests for appointments that we get for all the services that we provide. And to do that, we need financial support.
Andrea Skolkin is the CEO of One World Community Health Centers. She tells us community health centers need to grow to handle the current patient load and to reach out to those who put off going to see a doctor.
That creates a problem for people, and they'll delay going to the doctor for just routine things where you can catch things early, or chronic diseases like diabetes or hypertension.
One World Community Health Centers provide services to 50,000 people across the metro and in Plattsmouth, and they're hoping to get more financial support from the unicameral. The Health and Human Services Committee of the Nebraska Legislature heard from community health care providers from outside of the metro. They told lawmakers the need is also growing in their area.
Heartland Health Center is the newest health center in the state, located in Grand Island. We were established in 2014. The first year we saw 841 patients, and last year we ended the year serving 7,300.
Tammy Smith is the CEO of Heartland Health Center in Grand Island. She says those growing numbers mean the need for more growth in community health care providers. And in her area, right now there is a shortage of dentists.
Our wait list is well over 3,000 because they're literally coming to Grand Island from Grand Island south down to the border, McCook. I sadly watch nursing home patients ride in a van for 2+ hours from the McCook nursing home to come up and get dental services.
Community health care providers across the state all need more health care workers. Officials are hoping this legislative meeting brings attention to the role community health centers provide across the state.
We want to make sure that there is affordable and that health care is available to everyone, and that's what community health centers are about.
On your side in Omaha, I'm John Chapman, 6 News.
We're told community health centers serve more than 115,000 people across the state. One World Community Centers provides care for the majority of those patients.